uh, the chair, the president, Kenya Psychiatric, my chair, Madare National Teaching Hospital Board, distinguished guests, good morning. Uh, I am privileged to stand before you, make a presentation, a short talk in form of a presentation about I hope this is better. A short talk guided by the slides. It will be brief on mental health and the national development. Uh, Generally, before I speak about health and national development, I want to say that I've worked in the health sector for quite a while, since 1992. And from formal work, I'm about to exit. And I want to encourage us all, especially those of us who are young, in as much as we engage in professional career in clinical work, that we also need our footing in the management of the health sector. Uh, this slide here shows the interplay between health and the development. Uh, if a child is sick, it leads to increased fertility, which leads to high dependency ratio. If an adult is sick, it leads to reduced productivity. And all this lead to low GDP and underdevelopment. Let us keep this, and I will tie it down with mental health in a short while. Here, I want to relate health system strengthening. This is a universal slide which can be used to also explain strengthening the mental health system, how it speaks to universal mental health coverage and a sustainable development. For us to give service, and that is what we do as technical people, we need workforce. And I emphasize that for us to attain universal health coverage, we need workforce. And I want to emphasize again that in our country, we do not have enough workforce in the mental health space. And I want to encourage us all, whenever we have an opportunity, to emphasize the importance of having adequate, well-trained, motivated mental health workforce, right from the primary care facilities to the national facilities. As you are aware, in Kenya, we do not have a functional mental health referral system. And the most important single limiting step is absence of mental health workforce at the community level, at level 2, level 3, and level 4. Indeed, there are several counties that do not have a single mental health worker, and this is a tragedy. The health workforce, they use medical products to offer service. Availability of healthy products, for mental health is not adequate. At the Madare National Teaching and Referral Hospital, we have tried. Currently, our prescription refill rate is upwards of 95%. But then we have a challenge because when we discharge our patients, there is a problem of continuity of care when we do not have these products at the primary care facility level. We manage our patients within an infrastructural setup, and it is open knowledge that the infrastructure supporting mental health services delivery in the country is inadequate. Most counties do not have infrastructure to support mental health care, and the mental health care, unfortunately, has not been integrated well into the mainstream health system. For us to do this well, we need to utilize information for decision making. We need to capture our data well, process it well to inform policy and strategy. You realize that in Kenya, the data capture we have been having for mental health has been very scanty, summarized basically as psychosis. But I want to inform this gathering that we have worked together with the ministry to develop new data capture tools that are more detailed, and we will be able to capture important data, which when we process will inform policy and strategy. Now, the workforce, the health products and the infrastructure and the health information as regards mental health, all these building blocks will require financing. And for them to work well, we need a very good governance structure in the space of mental health system. This governance structure is still wanting. We are quite at the preliminary stages. We are working closely with the Ministry of Health to ensure that we have got a robust governance structure that can deliver mental health services in the country. And when we do this, then we will create a responsive, efficient, fair, and a quality and a resilient mental health system that can respond to the mental health disease burden in our country. Now, why is this important? This is important because health, and specifically mental health, speaks to Sustainable Development Goal number 1, reduction of absolute poverty. And I'll explain in a short while. It speaks to quality of education. Mental health has a direct bearing on school enrollment and the completion rates. It speaks to gender equality. It speaks, of course, to access to healthcare, and it speaks to an inclusive in economic growth and decent jobs. There is a clear intersection between mental health and national development. Mental health plays a crucial role in the overall well-being and the productivity of individuals, communities, and nations. Simply put, without good mental health of a nation, without good mental health of citizens, it is difficult to achieve the well-being of the citizens, to achieve productivity of individuals and the communities and the nations. Understanding the relationship between mental health and the national development is essential for policymakers, researchers, and practitioners alike. And I will draw you to the Lancet Commission report, which has detailed this very well. This is important for us as practitioners in mental health that anytime we have an opportunity, we have to present mental health as a development agenda so that we can bring policymakers to appropriate enough resources, starting from health workforce to products and technologies and infrastructure to speak to mental health. Mental health influences the GDP of a country. It influences productivity. When people's thinking, people's emotions, people's cognitive abilities are up to date, they will be productive. When the worker's emotions, the worker's feeling, the worker's behavior is affected, then the productivity will be low or absent. On the other hand, low economic production of a country puts stress on the citizens, and they are more likely to develop clinical mental health disorders. In this egg and the chicken business, it is important that we tackle the mental health and invest in mental health for economic prosperity of a nation. Mental health affects the costs of the healthcare system. It is clear and it is published in many journals. You can research and that people who have an underlying mental health issue spend more within the health sector. Then it is in the selfish interest of any government to ensure that people are healthy to reduce the strain that we put on the health system. And it is us here in this room who can use every opportunity that we have to bring the mental health agenda to the top of the government priorities. Mental health speaks to the welfare of the people. People who have got mental illness inevitably, like in our setup, becomes destitute and their families are impoverished. To address this social welfare, it is imperative upon us to promote mental health within government so that it is a priority. We know clearly that people who have mental health issues are prone to be on the wrong side of the law. For us to address this issue, if I was given a chance, we will flip the investment into which we put into crime prevention, some of it to go into the mental health, because once we have managed the people's mental health disorders, the tendency to crime is reduced. Ultimately, the impact on economic productivity, the healthcare costs, and the social welfare costs lead to reduced gross domestic product. Now, this clearly tells us that as we are gathered here, we got work to do to ensure that mental health is a government investment priority. Mental health has a profound effect on literacy rates, that is the education, where literacy is clearly defined as ability to read, write, and comprehend information effectively. Literacy empowers individuals to access education, participate in society, and achieve personal growth. Now, if a child has a mental disorder, is unlikely to realize this. If a parent has a mental health disorder, the children are unlikely to realize this. So for us as a government, we need to invest in mental health to facilitate improvement in school enrollment and completion rates. So literacy rates are an essential indicator of a nation's education development. Policymakers, educators, and healthcare professionals need to design effective interventions and strategies to improve both mental health and literacy rates. We know clearly that child and adolescent psychiatry services are only available in Nairobi. You can picture and imagine how many children are affected by lack of these services in the community. Social medicine into small, tangible investment cases at community level in terms of mental health promotion, that we need to quickly mainstream mental health into healthy promotion at the community level. We need to invest in early identification and the intervention of mental health disorders. We need to integrate mental health services into the school health program. So whenever we have space, these are strategies that are not very expensive that we can partner with to invest in as a government so that we ride on the existing programs to promote mental health. Mental health influences the individual's productivity. We know this very well, that somebody who has a problem with his mental well-being, deranged emotions, deranged feelings, deranged thought process, they cannot be productive. We cannot attain education levels, that is our potential, if we have a problem with our mental health. Workforce participation is impaired. Many sick-offs, many underperformances, and the like, leading to low productivity. This leads to reduced economic growth and a reduced societal cohesion. Then what do? We need to craft effective mental health policies that speak to early intervention, clear, measurable, preventative strategies, clear destigmatization efforts, and I like to use the example of tuberculosis and HIV. Our government has invested heavily that when people have TB, it is no longer stigmatized as in the 1970s. HIV is no longer stigmatized. People access treatment all over the place, anytime, and they live a productive life. This is the level of effort that we require to put in stigmatizing mental health disorders. We need to improve access to treatment options and the use of the recent proven interventions, both in pharmacology and also in psychotherapy treatments and the social medicine interventions. This requires investment in health workforce. We need to integrate mental health care into primary health care. We need, as Kenya Psychiatric Association, to come to the front line to do capacity building and technical assistance to counties so that the people who are currently working at the front line at least have basic knowledge to pick a mental health disorder. If they cannot treat, at least they refer for treatment. And at national government level, and I'm happy to note that the senior officers from my ministry are here, we need to foster collaboration between various sectors, the healthcare sector together with the education sector, so that we identify these children earlier and put interventions much earlier before they overtly become sick. We need to partner with labor and the social welfare so that we are able to put programs to promote mental health well-being in the workplace and access to treatment so that we can achieve greater prosperity from these professionals we have invested in training. And we need a robust welfare protection system for people who unfortunately are suffering from mental health. Currently, and I want to say this, that we have got a very clear criteria for registering indigents, people who are destitute, into the UHC scheme, but we haven't had a campaign to register our patients who have mental health disorders into the National Health Insurance Fund so that they can access these services at free cost to the patient. We have done this very well with other key populations, but I want to note that the mental health space has not been factored into this, and we need to work together to ensure that patients who have mental health disorders are also categorized as indigents so that they can benefit. Clearly, somebody with overt schizophrenia will know very well that he is not economically productive. But then, what is the mechanism that we are putting in place to address their access to healthcare? These are the issues we need to work on, and we need your support. There are policy implications again, which I can summarize. We must prioritize mental health promotion is key. Investment in comprehensive mental health care system is key to detect mental illness early, to prevent it, and to treat it early and treat effectively. Reducing the burden of mental illness on individuals and the society and the countries can enhance productivity. Actually, it does enhance productivity. It reduces the total health expenditure in the country, and it improves the well-being of individuals and the communities and the society. In conclusion, the relationship between mental health and the GDP is complex. Mental health disorders have a detrimental impact on economic productivity, health expenditure, social welfare system, and public spending. Conversely, GDP influences mental health outcomes through socioeconomic factors. We need to start by investing in improving access to mental health care, right from the primary care level to the national level, to be able to spur national development. Recognizing the importance of mental health promotion and investing in a comprehensive mental health care system are crucial steps towards fostering economic growth and improving societal well-being. Thank you. And as I finish, I want to tell this important gathering that Madare National Teaching and Referral Hospital is now a state corporation, and we are working towards its transition. And soon, before the end of this financial year, if you have an interest in mental health research, in mental health management, you are encouraged to apply. We bring you on board and mentor you into mental health research. We have a research unit that is coming up. We have made steps, and we will be recruiting people to run this unit. And also the legal notice establishing the hospital gives us a very clear mandate on offering highly specialized psychiatry services. So we will make a deliberate effort to support those health workers will be joining us soon to subspecialize so that we are able to deliver our mandate. So I welcome you on board to join us in Mathare National Teaching and Referral Hospital. And you have seen our vision is that we are working to be a beacon of excellence in mental health services delivery, training, and research. And we say that our business in Mathare National Teaching and Referral Hospital is healing minds and restoring lives and touching families. Thank you so much, distinguished guests, ladies and gentlemen.
Thank you so much, Dr. Ogato, for that insightful